Hi, my name is Emily Thomas. Today is May 19th, 2022, and in this video I will be presenting my Unit 2 Case Connections assignment. I will be presenting my responses to cases 3 and 4. So for case 3, based on the information provided, this 5-year-old boy must have type 1 diabetes. This is evident since, as the chart shows, the patient's baseline serum insulin level is much lower than the normal acceptable range, and even remains much lower than the normal range 1 hour after a glucose loading test. This already stands out as an unusual baseline level. This lack of insulin causes an issue in the body since insulin is an important enzyme that activates the body's rate of glycolysis, which is the process by which glucose is converted into a source of energy for the cells. The lack of insulin leading to the decreased rate of glycolysis in the body would in turn cause the patient's fasted blood glucose levels to be above the normal range, since the glucose the patient is ingesting isn't being converted through glycolysis. Rather, the ingested glucose remains in the blood, in other words, making the patient hyperglycemic. The patient's symptomatology is also consistent with classical signs of diabetes type 1, which are excessive thirst, frequent urination, and weakness and fatigue in this case. These symptoms are due to the lack of blood sugar in the cells to use as energy, since insulin isn't available to stimulate glycolysis to convert blood sugar into fuel for the cells. In serious cases, this hyperglycemia will lead to diabetic ketoacidosis, which is life-threatening. Two regulatory enzymes that will be active in this individual's current condition are hexokinase and glucokinase and pyruvate kinase. Firstly, hexokinase or glucokinase will be active because the abundant amounts of glucose in the blood will trigger the body to activate this enzyme to undergo glycolysis to convert the excess glucose, especially since insulin isn't doing so. In turn, pyruvate kinase will also be active because with the increased activity of hexokinase or glucokinase, and also in turn PFK1, fructose 1,6-bisphosphate is produced more, which leads to feed-forward activation of the enzyme pyruvate kinase. Now for case 4, I came to the conclusion that the correct answer is a glycogen storage disease. So I came to this conclusion through the process of elimination. To start, choice A, hereditary fructose intolerance, can't be the correct answer, since the baby has not ingested fructose. She has only been given breast milk since birth. Breast milk is made up of only glucose and galactose, not fructose. Therefore, while the symptoms of hypoglycemia and hepatomegaly align with common clinical manifestations of hereditary fructose intolerance, it is not the correct answer in this case. Choice B, galactosemia, is a deceiving answer choice in that the symptomatology can seem like it fits, but in reality it is incorrect. This condition can align with the hepatomegaly and maybe even the jittery spells that the baby is exhibiting, but the inconsistency is that these symptoms that the baby has are very newly onset. While the lecture says that classical galactosemia can be detected anytime after birth, it was emphasized that it must be detected promptly because children with this condition can have a life-threatening crisis within the first few days after birth, since breast milk contains galactose, and so does many baby formulas, which would instantly pose as a problem for newborn infants. Since this infant is only exhibiting these symptoms as a 2-month-old, this diagnosis of galactosemia is unlikely. Choice D, glucose 6-phosphate dehydrogenase deficiency, is also not the correct answer because in the lesson we learned that the clinical implication of this deficiency would be that red blood cells wouldn't be able to reduce glutathione as efficiently. This would then lead to an accumulation of H2O2 in the cells, which causes hemolytic anemia, which decreases the lifespan of erythrocytes. This condition has no clinical effect on blood sugar levels. That leaves us with choice C, a glycogen storage disease, which fits all of the clinical signs that this 2-month-old is exhibiting. The biggest giveaway was the fact that the administration of epinephrine led to an increase in blood lactate. This implied a connection to the process of muscle glycogenolysis, which is the process by which muscle glycogen is oxidized to lactate rather than glucose, due to the lack of glucose 6-phosphate, and this process is activated by epinephrine. A glycogen storage disease, since the body is unable to adequately break down glycogen into free glucose for the body to use, would lead to glycogen being trapped in the liver, which would in turn manifest as hepatomegaly. Since glycogen isn't being broken down and released into the bloodstream, it would also lead to hypoglycemia or low blood sugar. All of the infant symptomatology aligns with the clinical manifestations of a glycogen storage disease, and therefore the correct answer is choice C.